had the topic of looking into the Varicella zoster virus. So just an overlook on it. The casual agents are chickenpox and herpes zoster, aka shingles, are a contagious disease that is caused by the Varicella zoster virus, which will be known as VZV. The virus is responsible for chickenpox and or shingles. Uh, the chickenpox virus is one of the most popular viruses in childhood. Some adults with weak immune systems are at risk for getting the virus too if they do not have the vaccine as a child. One of the most important things to get is the vaccine. Um, I actually remember growing up that my family members had it. I think three of my siblings. My sister had it, and I didn't have it because by the time I was born, they had the vaccine out already. So I had the pleasure of not suffering through it. The next thing is the transmission. According to the CDC, uh, chickenpox is a virus that spreads easily from people with chickenpox virus to those who have not had the disease or have not been vaccinated. One of the most important things is the vaccine that I'll get into later in the presentation. I will basically go more in depth on it. The virus is usually contagious by coughing without covering your mouth, sneezing. One of the most important things, if you're feeling sick or have any side effects of anything, is to just stay home. It can basically save people. Washing hands is another big thing that you have to do, especially now that we're in a pandemic still. Um, that's one thing that we learned was to always wash your hands all times of all day. The epidemiology, so roughly 7,000 people per year die from the chickenpox. That is roughly 7,000 hospitalization per year around the world. And as I said before, it is a common disease that is targeted towards children. Um, and the Varicella zoster virus, which is VZV, as I said before, has an infectious rate of 90%. So if you get the virus, you have a 90% chance of actually getting it if you're not vaccinated. The pathogenesis. So the virus spreads to multiple places. The lymph nodes is one of the things. That's why whenever you're sick or have any symptoms, you usually go to the doctor. One of the first things that they check is your lymph nodes to see how they are. It also spreads to the liver and the lungs. The virus makes its way to the skin via the CD4 and the CD8 T cells. As the virus progresses, small skin vesicles start to form on the skin, as seen in this picture here. This child has it all over his body, his arms, his stomach, also his face, and down here by his ears. Something about the virus is it's super itchy, so that's why they tell you that if you do ever get the chicken pox, do not scratch it. It's very tempting though, since you have bumps all over your body and they do itch. So I don't know how the kid is staying still. Signs and symptoms. The big sign here that we should be looking out for is a rash that turns into an itchy, fluid-filled blister that basically shows up on the back, chest, face, and spreads all over the body. Symptoms that usually appear 1 to 2 days before the rash includes fever, tiredness, loss of appetite, and a headache. Those symptoms are associated with a lot of stuff. So the big things to look out for when you're examining yourself or examining someone for chickenpox is the rash. and I'll get into that a bit deeper, I think, in the next few slides. The diagnosis. So, diagnosis of the Varicella zoster virus are made by an examination by a medical doctor. They examine the blisters and chickenpox to see how they are. Um, Differential diagnosis. So, um, diagnoses that are similar to the chickenpox but are not the chickenpox are insect bites, smallpox, impetigo, and dermatitis herpetiformis. I hope I spelled that right. I said that right. So the first picture here is chickenpox, as you see. The second picture here is smallpox. So comparing these two pictures, there's a lot of similarities with them. It is very, very, very hard to tell the difference. And the last one here is the dermatitis herpetiformis. So comparing all these pictures, they all look similar, so they're very hard to distinguish. That's why it is told to go to a doctor where they can run a complete blood count, check for antibodies, antigens, and to basically look at the blisters to see if it is chickenpox or if it's something else. Treatments. Some medications include the tropical calcium lotion that may relieve the pain, daily cleansing with warm water to help relieve secondary bacterial infections, and one of the last things is acetaminophen, which will relieve the fever. And it is told to avoid aspirin to where it may cause Rice syndrome. So Rice syndrome is, they don't know the cause of it, but it is popular in children that do come up with chicken pox. So prevention, one of the big things that I mentioned is vaccines. So especially now that we're in a pandemic, one of the big things to do is get vaccinated. That way we can hopefully go back to our normal lives. So getting vaccinated is one of the best ways to prevent chickenpox. It is also one of the best ways to protect children from developing and suffering from chickenpox. So the chickenpox is a two-step vaccine. The first one is taken 1 or 2 months after you're born, and the second one is usually around the age of 1, after the age of 1. Just comparing COVID-19 to the chickenpox, I basically just wanted to add this in there. COVID-19 is an mRNA-based vaccine. Chickenpox is a live vaccine. So COVID, you usually recover 10 to 14 days after you get the virus in your body. Chickenpox is 7 to 10 days. COVID targets all different kinds of people, so all kind of children can basically get it. All kind of people, sorry. Chickenpox is targeted towards there was a the slides is a little bit inaccurate because I misspelled something, but chickenpox is mostly found in children versus COVID-19 is found in all different kinds of ages. As of April 28th, there were 3.13 million deaths around the world from COVID, and chickenpox had 7,000 deaths annually. And in January, there were 128,766 hospitalizations, and for chickenpox, it was 9,000 annually. And just covering the prognosis real quick, in children and infants, it is usually mild to self-limiting and uncomplicated. Some complications may occur in children, which is bacteria skin sepsis, which is common in children, and ACA, which is acute cerebellar ataxia, which is common in older children. Adults is the prognosis is a bit higher. The mortality rate is usually 31 deaths in 10,000 people, which causes 20 to 30 people, 20 to 30 hospitalization visits within 10,000. For chemotherapy patients, it is one series of studies was found that chemotherapy patients developed increasing chickenpox with multi-organ involvement compared to those in remission. And the last two things here is HIV patients, so children with AIDS, also acquire chickenpox in hospitals, developing pneumonia, and 5% of children die. In a study that was shown, 73 children had HIV and chickenpox, 83% had symptomatic HIV, and 14 children received the Varicella Zoster virus vaccine. And in newborns, it's a bit higher because so basically if they develop chickenpox within the first 28 days of life, they have to be checked out. And if the mother had chickenpox if the mother developed chickenpox 7 days before or 7 days after the delivery, there's no transfer, so the child doesn't have any antibodies to protect him or her, and they're at a higher risk of dying from the virus if they can't fight it off. And here's my references, and that is pretty much it. Thank you guys for listening, and enjoy the rest of your days or nights.